Qualcast Nation, I've been waiting to do this one for a while. We have Dr. Jeff Alfonsi in the mix, founder and all-around warrior of RxFood.co, and really glad to have him on the show. Welcome, Jeff.
Thank you. So happy to be here. Thank you for having me.
Absolutely. I think one of the things that you and I share in common is the need for prevention. We've both seen the devastating impacts of being hospitalized, whether it was COVID, whether it's just in general to acute care hospital. But yeah, maybe give us a bit of your background and story. What led you to start the company?
Yeah, for sure. No, thanks a lot. And so, just as my background, I'm internal medicine, and then I'd actually done some engineering prior to medicine, and I had a good friend of mine who did engineering with me, and she had lived through an eating disorder for decades, and she'll share that that was a significant challenge for her, and she had a good friend living with type 1 diabetes who was trying to count carbs and was really struggling with control, and so the two of them came to me when I was in residency. I'd done some apps technologies, and they said, "Hey, can you help us with nutrition?" And I was like, "Yeah, you know what? That is a really important problem. I get asked that all the time. I had 2 hours of nutrition lectures and 9 years of training. I don't really know what to do about it, but I think it's important." So obviously that led to us getting the right people learning. And then from there, I went on and did my extra training in obesity and lifestyle medicine. So rounded out a lot more about nutrition understanding, and I've been lucky to work with amazing experts in the field. So really, it was my co-founder Liz Choi that really kind of opened my eyes up to the importance of this, and really grateful that that happened.
Oh, absolutely. And you made a great point, Jeff, that we cannot overlook the idea of 2 hours of nutrition training that we received during medical school. And that, unfortunately, folks, is not an exaggeration. It really is minimal exposure. And I mean, we'll get into it in a bit here, but I think you could fully see the power food has in terms of healing and disease prevention.
100%, 100%. And I think, I didn't appreciate it. You think about all of our chronic disease guidelines on how do you care for diabetes, high blood pressure, right in front and center. There's a nutritional section, but it was typically something I glossed over as this, non-pharmacological or non-medication kind of bit. And but over time, you realize this is actually what everyone's asking about. How do I prevent things? How do I not need more medications? And then when you actually see it work on people, and when they do make that change, and you see the impacts on whatever health outcomes that you are measuring for that particular disease, or just them saying, "I feel so much better," you realize like there's a lot here that I've been overlooking for so long, and then I think we can do so much better.
100%. It's really is inspirational knowing that you can often provide people with the tools, in other words, nutrition, and doesn't have a huge side effect profile, doesn't have for the most part direct uh, effects on other medication. Like it's just something that's more pure, and I think a lot of people can get behind that. So what do people expect? Like if you like, what do people expect signing up for RX Foods? Like what does RX Food deliver to folks?
Yeah, absolutely. So, really when we created technology, we wanted to say, how can we simulate going to get blood work with nutrition, like to that point, or measuring something like we do in medicine, whether it being an x-ray, like you get a test, you get a report, right? So how can we kind of simulate that idea for nutrition, right? Or for what is on your plate? Because at the end of the day, that's so important. What are you eating? And so what we created with RX Food is some really powerful AI that lets you just take a picture of that plate. We've got really, really powerful capabilities to figure out what's in it, the approximate size, and also drilling down into important variables of that. Like, is this whole wheat bread or white bread? Because that actually makes a big difference. So we want to extract diet quality as well. So that was the first part, make it really easy for me to track. And we spent a lot of time doing that, met with a lot of individuals who had done tracking, whether it be for diabetes or not, and make sure we get that information super easy. And so, we're really happy when we do meet with people that used RX Food, they say, that was the easiest and best experience. Like, I really enjoyed that. The other thing that we've done is said, we've bounded this to say, like, you can use RxFood all the time if you want, but if you can just do 3 days of really good tracking, we're going to create a report for you. Again, simulating that idea of going to get other tests done. And so we interpret that information on the plate to come up and say, here's some data, like here's how much fiber you had, or here's what kind of proteins you're eating. So how much red meat or plant-based, and we present those numbers to people and we tell them what foods contributed to that. And people have just said, that's been really eye-opening, so I understand what I'm eating. And there's actually a whole bunch of small changes I can make that I just didn't realize by seeing that. And then, a few kind of bonus areas that we do with RxFood is we're just starting to do some really cool meal suggestions. So based on what you ate, what you don't like, we'll actually feed in some meal plans, recipes, or ways you can substitute ingredients to like nudge your diet a little bit for your goals. So we really love that idea to personalize that. And we also do some really cool things where you can hook up a sensor called a continuous glucose monitor, which will measure your blood sugar levels and actually show how your food affects your blood sugar. And that's been super amazing biofeedback for people. And traditionally, people with diabetes would wear these sensors, but we've had a lot of people just do, a 10-day or 2-week sensor just to learn what their body and response is. And it's super powerful. So it's all about trying to take food, make it easy to get that information in, make it actionable, and make it personal.
This is why I've been so excited to have Jeff on, folks. Like, this is a way of transforming the approach to nutrition for so many folks who have been struggling. So, number one, the tracking. This is the first of its kind that I'm aware of, Jeff. And I'm sure there's other companies doing similar things, but from my personal experience, knowing that everyone's got their smartphone with them, you could simply take a picture of your food. Like, if you think about some of the other apps that I've used in the past, like MyFitnessPal, where you're making making a ton of assumptions. You're what type of chicken, how much ounces is it, or how much grams, and you plug it in, and obviously it's your best guess. But knowing that you could take a photo, take the guesswork out of it, put it in the hands of RxFood, that is exciting. It really is. And I think, and as you alluded to, people feel like they can do it, like it's achievable.
Exactly.
Yeah.
Exactly.
And
It is great.
yeah. Oh,
Great point. And I think you hit on a great point with things like MyFitnessPal. Like, we do like to say RxFood is it's like nothing else that exists. Like, we try to say that this is a medical grade, secure, accurate, proven, studied product. But I think you hit a really key point with, when we did interview people about experience with MyFitnessPal, they would give the example of, I had orange juice and it took me like 5 minutes to figure out which type of orange juice. And then I didn't know how much I was having. So you're absolutely right. Something as simple as that can cause challenges. And so that was the key. Take a photo, make it easy, and just extract what matters from that, and do it in a way that's evidence-based, that's sensitive, and it also can link back to a clinician if you need, right, to guide you, right? So
absolutely. And the other component of this, as you mentioned, the reporting. So just to dive a little bit deeper into that, like you mentioned that it talks about your macros, like the protein, type of protein that you're ingesting, but is it like strictly macros? Do you get into some of the electrolytes or micronutrients as well? Like what happens from that perspective?
yeah, for sure. No, we have lots and lots of data. Too much in many cases. We actually tell people when we work with them, to customize down the report to just like a more tolerable amount, because we can spit out all sorts of stuff. So macros for sure, time of day when you're eating, how much protein you're eating at different times of the day, what your plate looks like, so how much vegetables versus meat, the quality of your grains, the quality of your proteins, ultra processed food intake. We can look at glycemic index data for people with diabetes. We can look at potassium data for people with maybe that need to watch it for, let's say they have a kidney problem or a heart problem. And we can show all the macronutrients, to see the approximate vitamin D level, or, the zinc level. So there are certain groups that we work with where those are actually really important. And so we can make it much easier to get approximations of those sort of inputs. So very flexible to be fit in to a whole bunch of different use cases across the the clinical setting.
That's so exciting. I mean, it's a fair point. You don't want to overwhelm people with data, but at the same time, if you're that type, no
Yeah.
offense to engineer or what have you, that really want to dive deep, at least you have that option. And at times you're probably going to see some patterns that maybe aren't intuitive to many. And I really like the idea. I think this also brings to the next level, the meal suggestion, like, or the tweaks, because I think this is what I know a lot of people in my circle struggle with. Say you're you are trying to increase your protein intake, or you're a type of person that tends to snack a lot. So like, what options or alternatives are out there? This to me is next level, Jeff.
Yeah, no, we're really excited about this. I think when we chatted last, we were just working on it, and now we've just kind of put it out live, and I've really enjoyed it. To your point is when you show someone a recipe or a suggestion, they said, you know what, that's I would eat that, and I've done it with myself and said, hey, that's a pretty neat combination of stuff I wouldn't have thought about, but they're all things that I had eaten and met my goals, and so I tried new things, and so it makes it a lot of fun because, like I said, it feels like it's you a bit more in these recipes because let's say you did your 3 days of logging, it looks at all those types of foods you ate and it uses that information plus other things to come up with these suggestions. And like I said, it feels nice when it has that personal touch to it. And so I've really enjoyed this and in working with patients, had a lot of fun giving them and seeing, how they've kind of been like, oh, I like that. I could do that. That's perfect. Great idea.
Oh,
Like I love when I see those sorts of things. So.
yeah, because Jeff, I think that's what brings things to the next level in terms of who's in front of you and what will they respond the most to. Like I love the idea of personalizing suggestions because as you and I both know, like one person might respond to something better than another. Like it's hard to have a cookie cutter
Yeah.
approach when it comes to nutrition or health in general, but especially nutrition. And that idea of really focusing on what that person would most likely succeed with. Yes, like that's where I feel like that's where we need to go as clinicians in general. Like this is the general direction we need to go.
100% agree. And traditionally, and this was a bit, my bias early on was when you started talking about nutrition, and this was, probably before I did a lot of RxFood, it was basically like, oh, you have to eat better. It was kind of this, you know, maternal or paternal type of approach saying, watch this, eat better, do this. And it was just very simple. Have more vegetables, eat more red meat. But it just doesn't really do much. People say, I know that, but how am I going to do it? What am I going to do about it? How am I going to make that change? But when you actually said, look, I looked at your numbers and you really care about increasing your protein so that, you have strength or you don't fall, or we know there's maybe longevity benefits to that, right? So, you want to keep your protein up. Here's what you do. Here's how we can do that. And they're like, you know what? That matters to me. You made it matter to me. And you gave me ideas that actually sound like I care about them. And you took the time to understand what I'm eating to make them matter. And so that just makes a huge impact in what people want to do next, right?
Absolutely. And when they see the light, they're more likely to execute. You know what I mean? Like they're more likely to achieve their goals. So this is beautiful. I also wanted to touch on the CGM. I got to say at a personal level, so I tried a CGM maybe about 2 years ago, 2.5 years ago, and my personal bias is everyone should try a continuous glucose monitor once in their life. I tried it for 2 weeks, and the information that I found to this day I implement. So as an example, if I do a leg day, I could eat anything basically and my glucose stays proper. If I have a fairly carby meal, if I stack it with a bunch of protein, it seems to mitigate that glucose response. For whatever reason, I'm really sensitive to white rice compared to, say, a cookie. And then what was the other big one? Oh, being on call. That was enlightening. So when I'm on call, no matter what I'm eating, well, I shouldn't say no matter what I'm eating. I was just way more fluctuant in my glucose. It was up and down compared to when I slept normal. And and once again, it kind of points to what Jeff was alluding to before, that personalization, really knowing how you're going to respond to specific foods. Like you must see, like you must be very enlightening, either at a personal level. I don't know if you've tried it, or with some of your
Yeah.
clients, see playing with the CGM.
Yeah, for sure. No, actually, thank you for sharing that. It's amazing. I've definitely worn it a number of times, and I think there's some. But to your point, I love this because we go through this data with someone and said, "Hey, you know what? Your probably stress levels and hydration and stuff when you're on call is different, and you should be. Maybe you actually need to focus on more regular eating, more protein, more long lasting, like you know what I mean, or more complex carbs. Like we can really get to that level, or it's really great to say what I tell people to experiment. So you tried white rice, also try like, I don't know, brown rice or quinoa. Just look at the response difference between the two. And then you can mix them and say, hey, you know, maybe I don't like the brown rice or the whole grain, but if I mix the two, does it improve my results? And so, and there's a whole bunch of interesting individualization as well as stuff we kind of know, like protein or fats mixed with carbs or how much carbs you eat will affect your response, right? And so it is tremendously interesting. For me, probably what I really did a lot of fun things when I was playing was I was looking at, I really honed into breakfast just because I found that was like an easy one where I woke up, it was pretty predictable, and I tried different breakfasts out. And what was really awakening to me was, you know, was the impacts of cereal, right? And this cereal, like I did try to look at the label, right? I did look at it and it was high fiber, low sugar, whole grain. That caused the largest spike in my sugar over the 10 days of any
Wow.
meal. And I was like, wow. And so what I did after was I experimented. What if I do different amounts or add like, you know, hemp seeds into it or other things like, or sorry, hemp hearts into it? Like, can I modify the combination of foods? And I was able to tweak it a bit because I like that cereal, but I now modified what else I put with it in terms of, you know, fruits and proteins and fats to kind of level that out a little bit. And so tremendously insightful to do. And, you know, I 100% agree that everyone should try this out. And, you know, if there's ways to get you on RxFood with the CGM to try it out, we should do that because, like, I think it's super valuable for health and wellness. Yeah.
Wow. I honestly, Jeff, I love that example with the breakfast food, because I hope, just to clarify for the listeners. So basically what Jeff was saying was, you know, he would have normal cereal and have that, even though it was low fat. What would you say? High fiber, low fat, and such. And
It was a high fiber, low sugar. So
oh,
that was
low
how they
sugar.
described
Sorry.
it.
Yeah, and loves the cereal. Had a high glucose, the highest glucose response out of all the stuff he's having. But because he loves it, he figured out a way to modify it, adding the hemp hearts or different types of things to reduce that glucose response. And that's brilliant. Like it really is. That's what I like about this is, like, say you're married to a food, say you're married to pasta, right? And you figure out a way to modify that surge, whether you just double up on your meatballs or chicken, whatever the protein is. Maybe that's enough for you to enjoy pasta on a regular basis. Like, this is what
Yeah.
is so brilliant about this.
Yeah, 100%. I love that. And I say that I tell people to mix lentils into their pasta sauce because you
Oh, that's a good
barely
one.
taste it, but you add this fiber and then like that can make a big difference. It fills you up. You have a little less pasta, but it's still enjoyable, right? So 100%. When we talk about people about making change, it's still you do what you like. You're just gonna make some tweaks. And the dietitian I work a lot with, she's awesome, and she's like, if someone's having craft dinner, that's fine if that's what they love, but I'm going to figure out what we can put in that craft dinner to make it a little bit better, right? And so that's still progress, right? To me, that still made
Hmm.
a change. If you're adding some legumes or some vegetables into that, that's a win, right?
Absolutely. And you know what is also important to mention with that, Jeff, is that they're more likely to succeed in their wellness health journey because they're still eating what they love. You're not telling them to stop doing or eating what they truly enjoy. You're telling them to modify it in a way that's going to make it healthier. It's so much smarter than how we've, especially in the medical culture, just saying, no, this is what you need to eat. Stop eating the XYZ. Focus on this. And even though we only get 2 hours of training to
Yeah.
talk about it, but I just think you're lining people up for success by working with what they enjoy.
100% agree. And that, that was a big learning early on when I was spending more time with those really great people that I thought were teaching nutrition. And that was what they did so well that they
Mm,
actually made someone say, I'm actually excited to do that. That actually sounds good. And I'm going to be better off for that. Like that's the powerful way to bring it home, right? And that's how you're going to make that impact and that real lasting change.
absolutely, absolutely. So it for RX Food, like who's a typical client, like an or an ideal client in terms of who would benefit the most coming along with your company?
Yeah, for sure. I mean, I think there's a lot of people, but if I had to say the ones that we've just worked the most with is really, you know, people living with diabetes, at risk of diabetes, pre-diabetes, gestational diabetes. It's been really powerful because there's a lot of self-management. It's a very overwhelming experience, and I've never obviously I haven't been diagnosed myself, but I can imagine all these things that you're learning of all these things that you have to do all of a sudden having to look at the carbohydrates in your food and understanding that there's a lot, right? And so, we wanted to really help reduce some of that burden, right? And say, let's just take a bit of that part off of you and give you some information that hopefully, again, makes that easier and actually an enjoyable thing to do. So I think that's the area that I think we've done the most in. But that said, I think really when you step back, anybody who wants to understand how they can use nutrition to either prevent or manage a chronic disease better, if you have that interest, then you should be using RxFood because it's going to give you that information. And the way that I tell people to do it is like, think of this like part of your periodic health assessments, right? You're going to go see your healthcare provider every so often. They're going to check some stuff, do some blood work, look for based on your age, maybe certain cancer screenings. I think nutritional assessments should be part of that. And so go to your 3-day food log. Let's take a quick look at it. Let's discuss it. Let's trend it. Let's see if it's getting what you're getting better in, maybe what's not going as well. And let's link that to your overall health. And so that's how I think we need to be thinking about nutrition in there. And I think the people that have gained that benefit are the ones that kind of think of it as this is my regular part of my regular checkup. I do it now. I do it again next year. I'm always learning. I'm always developing. I'm always improving. And that's like a really powerful approach to it.
I think that's smart, Jeff, and I like the idea that like you guys are taking away the barriers to be able to do these that level of assessment, right? A lot of people, and if you wanted to do what you were asking, think about what you'd have to do in the past. You'd log your food, whether it's through an app or through a written format, uh, and whether you get a CGM or not, either way, like it would be very labor intensive to be able to connect the dots. Whereas this is like a one-stop shop where people can make that connection with how they're feeling, especially if they want to optimize with chronic disease. And like you and I both know, like like the chronic disease state these days is like it's not getting better, unfortunately.
No, definitely not, and actually concerningly not, right? And I think you make a great point on that, and also to the fact that that's a big part of what we wanted to do by removing those barriers, right? So, no doubt there was many people that were sent home with a piece of paper and said, write down everything you eat for 3 days or whatever and bring it back to me. And I mean, I think some of the dietitians can interpret amazing stuff from that. But the average person, maybe without the training, it's hard, or maybe it's not very accurate, or it's a little limited in the data there. People don't always write the type of bread or whatever, right? So a lot of limitations. And I give the analogy that when I see people with high blood pressure, I tell them, that, now it's better, it's more digitized, but people used to write down just the two blood pressure readings, the top one or the systolic and the bottom one or diastolic blood pressure, and they'd write them down with their log and they'd bring them in. And even that, you're looking at 2 months of that and you're trying to estimate, the average blood pressure for the top and the bottom number to see if they're on target. And it's kind of a pain. And this is just two numbers. And you think about the multitude of dimensions nutrition has, the macros, the micros, the quality of the foods, the types of the foods, how they're cooked. Like there's just so much that you just can't get from paper. And And even from like searching my fitness pal stuff, we just lose so much of that information. And so that's a big part of what RxFood is about, is trying to capture that a little more in its like original form, but also then be able to automatically analyze that in a way that's actually really valuable and not just numbers, but actually getting at quality and factors and stuff that we can then communicate back to someone. Not saying, you're at the 46th percentile for your recommended daily intake of zinc, and like it actually, you make it really practical and say, here's the foods that were contributing to your zinc. Here's what we can do more about them, or here's the types of proteins you had. Here's what you can do about it, right? So trying to make it actually digestible, to use that phrase.
Yeah, Jeff, pun intended. The I mean, for all these reasons is why we're excited to collaborate. For those that may or may not know, we recently got a grant to look at reversing prediabetes and diabetes in marginalized communities locally in Ottawa, and I love the idea of RX Food complementing this. The idea that, as we mentioned earlier, this is a personalized approach to nutrition and how to optimize it with meal suggestions, with tweaks that people can make. But Jeff and his company are overcoming that barrier of what's the word I'm looking for? Availability. Like people
It's
will, or
access, right?
access. Sorry, access is
Yeah,
the word I'm
totally.
looking
Yeah.
for.
Yeah.
Yeah, and this is really exciting because I mean, Jeff, you could maybe speak if you feel this is true too. Like we saw with COVID, these chronic conditions are often hitting the people that are on the margins, that are, they're essential workers. We saw that multi-generational homes that can't necessarily afford to go to the gym and take time off. So I think the idea that this could be accessible to those that need it the most is exciting.
Yeah, I think it's really important. I mean, first of all, I'm super excited about the collaboration too. So just really excited about that. But I think on the point you had about, these social determinants of health, like food is such a component of that. And there are a ton of factors that impact someone's ability. First of all, like think about even just getting to see a dietitian. Like let's say many healthcare providers maybe don't have the experience, don't have the time. So let's say you did want to ask a bit more, you wanted to know what you could do to reduce your diabetes risk, for example. You may not have coverage for a dietitian. Like sometimes there are, but there are definitely times where you may not have coverage, or you may not have the time to take that hour off, or there are barriers that come to that. And we wanted to, one, remove those. And then the second thing we wanted to do is say, we also want to make that information something that you can take on your own, or you can still take to someone else, and maybe make those time with those clinicians more efficient. You don't have to repeat your story or remember for what you ate 3 days ago for breakfast and lunch, right? You actually can show real information and actually spend more time on getting that valuable feedback from someone. So I think those are some of the really powerful things. And then, like I said, we're really excited about the suggestion part, right? That we can tell people what they can do about it. And we do actually take into account in some cases, what are the most cost effective ingredients that you can use? Because,
Mm.
people have established that things like, frozen vegetables and fruit, or getting them when they're on sale or in the summer, and freezing them are a very great way to do that in the winter. And legumes, typically for, lentils, chickpeas, the fiber, the proteins that you get, per cost, is one of the best out there. And so we got to find ways that you'll enjoy these ingredients, but being mindful that, there's a lot of cost effective ways to do it. And I think that's really important. And then the other kind of part that we touch on too, and this is an area that, we don't go over with this one, but we highlight that many times the changes that you make to improve your health can often be good for the environment. And so again, we know there's a lot of complexity to it, but typically when you can move away from certain red meats, high processed meats, and move more towards kind of these legumes or plant-based, generally speaking, the greenhouse gas emissions to produce those foods changes significantly. So we give this multitude of reasons that, these changes also have bigger impact on whether it be cost and making things more affordable, or even trying to have a little bit of an effect on reducing your carbon footprint, right? So these are all the things that come together, that address the whole social area that wraps around around food. And even maybe the last thing is that we're trying to be very sensitive to the cultural and the types of foods you have. And so in the recommendations, we're trying to do that. You know, it's always perfect. We want to make sure that the recommendations that we make are ones that actually align with a culture or foods that they like or those flavors. Because we know, again, that food can be really powerfully linked to culture and history and all that. So it's a super fascinating and complex field when you actually get into all the aspects of it. But I think technology it won't do everything for that, but it can do a lot of the ways to get it there. And then with a few tweaks, you can really make it fit into all of those different factors to have impact.
I mean, think about how far you've come and addressing so many of these concerns, like the accessibility, the affordability, the cultural components, the environmental components. This really crosses a lot of T's, my friend, and dots a lot of I's. It really is exciting to hear where RX Food is going. And maybe, if possible, can you think of maybe a story or a example of a client how RX Food has impacted their lives?
Yeah, yeah, for sure. I think there's been a lot of great people that I've got to meet through this, right? Probably the one that I'm going to say comes to mind is one that probably because I think it made a big impact, but two, also we've known the individual for quite a while now and got to see it and regularly check in. So I think I'm going to start with that one. So, this was actually an individual living with diabetes, right? And they were newly diagnosed with diabetes and they required insulin. So it was more advanced, and they were having such a struggle really understanding what I'm eating, what I'm doing, when I get sick, how do I do my insulin. So lots of excursions, or means their blood sugar levels were kind of moving around a lot, almost like being on call, probably like that, just really hard to maintain. And one of the nurses that we worked with, or the dietitians that we work with actually at the clinic, said, "Hey, would you be interested in trying out RX Food?" And so she explained what it was, and the person's like, "Yeah, sign me up." And ever since, almost every day, and not everyone, I always say you don't have to use RX Food every day. Again, take breaks if you need, but this person every day, for the last couple of years has used RX Food. But the feedback that came back was like, what? I actually was able to learn how to control my diabetes better. I actually started to understand what was causing these shifts, what I could do about it, when I needed to check things, when I was like sick, how it was affecting things. And we actually measure a number when you're wearing, this individual also had a continuous glucose monitor, and you can measure a lot of statistics when you have that on. So one of them is, how much of the time were you in the target range or within the normal range that we'd want for sugar control? And he had great numbers to show that a huge improvement in the time and range after a few months of using RX Food, understanding how to do that. And to me, I just thought that was such a powerful story because it gave someone the tools to manage themselves. And I think you think about technology and apps and stuff, and people are not going to use those forever. We know that. But what can we teach them when they do use it, or when they pull it out, that can actually last and make real change, and be there when you need it? Like that to me was just like a really amazing example. And again, this is someone who had lots of stuff, lots of clinical help, lots of technology, all this stuff, and yet we could still make a difference in that person's life, right? And so I think the power of food, and the power of looking at it the right way, and the power of feedback, it's just really tremendous. So I'm really proud of that one.
That'll do it. That'll do it, Jeff. Honestly, and if you think about that amount of glucose control, that control your diabetes, what that downstream impacts will be, we see it on a regular basis. The complications of diabetes, whether it's cardiovascular disease, heart attacks, strokes, infections, skin infections, and peripheral vascular disease, needing amputations, and that's, I don't have the stat in front of me, but I think there's a significant amount of patients admitted in our hospitals that have issues with sugar control. So knowing that that client has got better grips on things and took the power back
Yeah.
is is awesome. And from a life, from a like longevity, from a quality of life, and from a cost effectiveness, my goodness, it's got to be a huge ROI.
100% agree, and I love that. And to your point, I fully agree that the amount of admissions related to complications of diabetes is immense. And I think you got to go downstream. You got to help people early learn. You got to help them empower. You got to help them control. And so I think that's a great point of the story that I didn't highlight. And thank you for highlighting that. Is that what that individual learned, I think can have huge impacts on going forward for that individual, the risk of hospitalization and complications of diabetes. And you know, as early as possible. And again, to your point of everyone wearing a CGM, you're even pre-diabetes, get that sensor and learn, right? I mean, again, this is not necessarily the approved use of a CGM. So I just want to highlight, or, maybe it's a bit of the off-label use, but I think stepping back and saying that there is so much value to get it early as possible, just learning and having those skills, so important, right?
Oh, I agree. I hear what you're saying. Like we got to be a bit defensive on the use, but I do think whether it is off, I don't know if you call it off label or what, but I just think there is tons of valuable information that can really dictate how you carry yourself. I think we'd be remiss, Jeff, to also mention the cost, because a lot of this sometimes can seem overwhelming. You hear about some apps or programs and they're hundreds of dollars. So can you give people a sense of how much it would cost to take part with RxFood?
Yeah, and most of the time we actually try to work with a healthcare provider, an insurer, or whatever, actually so that they take in the cost and so that the end person doesn't have to. And so in many cases we might work with like a family health team or a hospital where we've actually found a way to get the cost covered. I think that's important. So in some cases, there's many people that haven't had to pay anything for RxFood, and we're really proud about that. There are, we don't necessarily go all out and you're not necessarily downloading us from the app store and using it, but for certain people that we think they're at this point, if certain people that are valuable, we make it available. And we typically try to charge a monthly price, around $15-20 a month typically is what people can pay for access to it. And there's a few kind of programs we try to build around that. But the idea is we wanted to, and like I said, most of the time we find ways to get this covered in other means. And so the key thing that we've always focused on is how do we make this technology available without significant out of cost expenses, right? And so that's so important, right? I think you have to make it accessible, and we're always finding ways to drive that down or get it free for that person or something. So I think that's one of the key things that we're proud of too. Yeah.
Yeah, no, great point. And that's what I'm hoping with working with our grant here and our sample clinic here to give an example of how powerful RxFood could be and how it can hopefully will show some results of reversing folks' diabetes and ultimately give people a model for how to approach health. And I always say start small but act, and we got a green light to do this. It'll be great to then scale it and say to the higher ups, look, we've implemented this program, including using these tools. We prevented this amount of hospitalizations. We've reduced this amount of medications, so the cost associated with medications and emerge visits. So let's do this at scale, yo. Let's flex. Change the boogie.
Exactly. No, that's what we need, right? So that's what, everyone here, we need to kind of advocate at that level. Like these are tools that are so important and have such impact on the system, I believe that, and they're not that expensive, that these should be covered at a central level, so that it's not up to some people to pay or others or some people to get access. These should be fundamental parts of health in my opinion. So hopefully we can get that data and prove that and get it done.
Amen. Amen. So before jumping off, anything, where do you see RX food going in the next year or two? Like, if you could have the optimal crystal ball, what would you like to see the trajectory of RX food?
Yeah, I think I'm really happy where we are now. Like I think there's a few tweaks to the product out where I'm excited about, mostly around making these suggestions better and better. The other thing that we're really kind of excited about is the ability to actually order the foods that you need or the grocery list that
Oh,
you need to get it delivered to reduce that barrier. Particularly, can we help with better costs or like special deals for, or at least for certain healthy foods that you can get. So that's our point, is make it easier for you to learn, and so we keep doing that, give you more changes to make, but also make it as easy as possible for you to get that food and make that change. So that closes the loop. So that's something that I think is probably the big thing that we're driving for, the next big piece. And then the other thing is just is impact. We want this to be in the hands of every Canadian, right? And that's the next thing, is the vision that this is really the go-to for checking in on your health. So those would be the two ideal or key focuses for the next year.
amazing, amazing. And you're gonna get there, Jeff. How do people get a hold of you or learn more
So
about RX food?
yeah, definitely. So we have our website. It's www.rxfood.co. So just co. Also, happy to share my email. It's jalfonsi@rxfood.co. We can share that out other ways too. Happy to have people reach out, questions, ideas, anything. Love chatting with people about this topic.
Amazing, Jeff Alfonsi. This was better than expected, and I was hyped for this one, my friend. But thank you so much for agreeing to come on. And you are a true boogie changer, my friend. So keep up the great work.
Right back at you, man. This is awesome. You keep it up too.